Hi there, I'm Lisa Halsworth, professional engineer and CEO of RiskAssist Technologies, a company focused on workplace chemical safety. Thank you for joining me today for my talk on preventing cancer. I co-founded RiskAssist Technologies in 2016 after working as a chemical engineer for nearly 30 years. A big part of my job was chemical safety, and as someone who kept a close eye on software and looking for new ways of doing things, I wondered if software could be used to make chemical safety easier. Today, RiskAssist Technologies offers a cloud-based SDS management and chemical safety platform called SDS RiskAssist. Our software reads WSIB safety data sheets, chemical handling regulations, and best practices, and highlights chemical hazards so that employers can make strong and confident decisions about chemical safety. We work with government organizations, labs, educational institutions, municipalities, manufacturers, medical and dental clinics, and even small businesses like automotive shops. This work gives us a unique view of workplace chemicals, the risks that they present, and the people who are affected. It also makes us very aware of emerging trends in areas like occupational disease. And today, I'd like to talk to you about how easy it is for safety professionals and engineers to help prevent cancer. I would bet that we have all been touched by cancer in our lives. Young and old, the disease seems to have no boundaries, and we have seen the terrible toll that it takes on families. I would also bet that many of us have participated in campaigns like Relay for Life that fundraise for cancer research. But wouldn't it be awesome if you could help prevent cancer? To know that you did your best to save even one family from the pain and suffering. Well, I'd like to show you how you can. Research on what causes cancer has evolved leaps and bounds, and we now know much more about what causes cancer. This image from the International Agency for Research on Cancer maps out exposures to potential carcinogens by types of cancer that they can cause. And we even know that exposing our own body to certain carcinogens can not only affect ourselves, but our families too. What can we do about this? A recent report commissioned by the Ontario Ministry of Labour, Training and Skills Development and led by Dr. Paul Demers, Director of the Occupational Cancer Research Centre, revealed that in Ontario alone, over 3,000 cancers diagnosed each year are work-related. Dr. Demers' report reveals that a whopping 2.7 million workers are exposed to the carcinogenic agents shown in this graph each year, just in Ontario. The report goes on to discuss how past statistics and present exposure data can be combined to predict the number of cancer diagnoses in Ontario annually. And this graph gives you an idea of the attributable exposures. Some of you may be surprised to see shift work listed as a carcinogen, but the science has related it to breast cancer. Other carcinogens like solar UV and benzene are commonly recognized, though you, like me, may be surprised by the numbers of workers still exposed. This graph shows you the types of cancers that can be expected due to the exposures discussed in the previous slide. And the report even discusses the total lifetime costs of these cancers, including direct costs such as healthcare, out-of-pocket expenses, insurance administration, and informal caregiver costs, indirect, like productivity and output costs, and replacement costs for workers, and finally, intangible costs, such as the monetary value of the loss of health-related quality of life. For example, the report's estimated lifetime cost of lung cancer per case is $1 million, while the estimated lifetime cost of non-melanoma skin cancer per case is between $6,000 and $11,000. So this year's lung and skin cancers alone will come at a lifetime cost of $1.4 billion and $13 million respectively. Now you might ask why we haven't heard about this before. Because this is new information and scientists and governments are working hard to make the information accessible. In the fall of 2020, the Occupational Cancer Research Center collaborated with the Ministry of Labor, Training and Skills Development, the WSIB, and the Canadian Centre for Occupational Health and Safety to launch a new website to help employers, workers, and medical practitioners to see the statistics based on past data. Let's take a look at what the statistics are showing in some of the industry sectors that have been analyzed. Here is a graphic for the construction sector. The graphic shows the increased rate of certain diseases as compared to workers in other sectors that are being tracked in the occupational disease surveillance system. So in the construction sector, we can see that lung disease and bladder cancer is higher than for workers in other sectors. And we see the devastating and latent effect on workers who have been exposed to asbestos. In healthcare, we see large increases in breast cancers in both men and women. In metals manufacturing, the statistics show other cancers like liver, pancreatic, and stomach cancer. In mining, we again see the massive latent effect of asbestos exposure, but also the huge increase in silicosis and other lung diseases. And there are even statistics on the transportation industry. Here you see cancers such as melanoma, prostate, and non-Hodgkin's lymphoma. To date, these are the statistics that have been posted on the website. I have included the link for the website, and I encourage you to take a look. There's so much information that I can't summarize it in this presentation. So why aren't we seeing these statistics play out in WSIB rates, you might ask? Here are the WSIB statistics for 20 years between 1997 and 2017. As we can see, traumatic injuries are falling, but occupational disease rates are increasing. So part of the reason for Dr. Demers and his organization, why Dr. Demers and his organization were commissioned to do this report, was to gain a better understanding about occupational disease in the province of Ontario. The ministry wanted independent, science-based evidence to help develop their occupational disease policy, as well as to provide a reference so that workers and employers would have the confidence that compensation laws and decisions are based on up-to-date science and best practices. In fact, what Dr. Demers' report found was that only about 6% of the expected diagnosed cancer cases were receiving WSIB support. You see, most workers don't connect their illnesses to the workplace, and neither do their physicians. Imagine having no financial support if you suddenly find that you have been diagnosed with a life-threatening disease and you can no longer work. So how can safety leaders and engineers help? Well, if we look at the Occupational Health and Safety Act in Ontario, the law places a heavy burden on employers to protect workers from all hazards. Since employers and/or board of directors control budgets for businesses, they hold the ultimate responsibility for workplace safety. However, professional engineers and safety professionals are hired as experts to advise employers and boards, and it is our duty to understand the law and ensure that the public is protected to the best of our ability. In addition, part of our job is to stay abreast of the changing science and apply it in our work. So what actions can we take? Well, if you've made it this far into the presentation, you've taken the first step. That is to become aware that this problem even exists. The next step is to learn about new science in this area by visiting the cited sources online as well as other reputable sources. Then you can highlight the hazards in your workplace. And some of the hazards, such as skin exposure, as well as are well publicized, but many of the hazards highlighted in Dr. Demers' report are invisible. People have to go looking for them, and the best tools for these are ones that most engineers and safety professionals are familiar with: a hazards analysis and risk assessment. So once the hazards and associated risks have been identified, the hierarchy of controls can be used to eliminate or control the hazards. For example, in the construction industry, machinery is now being designed to limit sun exposure. Make sure that this option is written into the specs that you develop. In automotive service areas, ensure that ventilation systems are designed to manage occupational exposure limits for hazardous ingredients in the chemical products being used, and that vehicle exhaust is vented outdoors rather than within the working area. Purchase wetted stone cutters versus dry ones where possible to reduce worker exposure to respirable silica. Remember to think about those hazards where you don't expect them. In this case, mouth mold grinding in dental labs. Collaborate with employees to ensure that workspaces are designed to protect them in ways that make sense for their jobs. Read the WSIB safety data sheets for chemicals being used in your areas of influence so that you are aware of hazards that cannot otherwise be detected by the body. And where possible, look for safer alternatives. In the picture that I have compared a number of different graffiti removers based on the hazards stated in their WSIB safety data sheets. Assuming they all perform the job properly, it is easy to see that the first product is the safest choice for both the worker and the employer. And when there are no other options, ensure workers are equipped with the right protection to prevent harm. As professional engineers and safety professionals, we have the obligation to bring hazards to the attention of employers and to lead the way to find safer solutions. It is purposeful and interesting work, and I hope this talk has inspired you about how you can help to prevent cancer in your workplace. If so, please share this video with your colleagues, and thanks for watching.